I'm Sanjeev Saksena. I'm professor of medicine at the Robert Wood Johnson School of Medicine in New Brunswick, and I'm medical director of the Electrophysiology Research Foundation.
I'm Wojciech Zareba from University of Rochester Medical Center. I'm professor of medicine and cardiology, and I'm directing clinical research at our institution.
The idea of the book, the Electrophysiological Disorders of the Heart, was an interesting history of its conception. When John Cam and I discussed what we had learned in about 25 years of working in the field and what we thought the scope and breadth of knowledge that existed and how it could be distilled and presented, we had to first come up with a title, and we reflected on what that title could be. And I think the title in the end that we chose really reflected the fact that there were specific electrical disorders of the heart that had become a science by themselves. The time was right to call it a science by itself. So that's how, for those of you who have, many textbooks talk about disorders of whatever aspect of healthcare, this is electrophysiological disorders of the heart. So, and actually what we did at that time was we actually spent 2.5 days in a retreat at my home to discuss what we thought would be the needs of the community to look at this in a global way, and we realized that it was important to take it from the basic science, which had exploded, through the relationship with the clinical cardiologic spectrum of disease, and then connect that to the treatment options that were appearing in both the pharmacologic and non-pharmacologic options. And to do that, we thought it was really important to put all of this in one place so that students could go to one resource rather than having to go to separate elements of this whole piece. So that's how the first edition was developed. And as the first edition came out, we actually innovated and did sort of the first multi-authored chapters that had ever been done in this field. And that was a challenge, and then I think there was a concern about how that would be, the process would work, but they were very well received. So the integration of knowledge into either single chapters or the book was the strength, and from that we learned and got very good feedback on. And in the second edition, we recognized the fact that we had to expand the scope to a number of areas that had blossomed. Non-invasive electrophysiology that Wojciech has edited, the area of pediatric electrophysiology that Vicky Vetter has done, applied basic science that Penny Boyden expanded in this, and the area of ambulatory therapy or out-of-hospital therapy that Paul Dorian expanded in the book. So it's become a text for both cardiologists and electrophysiologists.
I would add that what Dr. Saksena mentioned about this multiple co-authorship was truly novel at the time when we had the first edition and second too. We used to write chapters on given topics, usually within given group or representing to some extent one side point of view, whereas having the concept of one chapter being co-authored by, let's say, 3 groups who do not work with other on daily basis and represent different perspectives on the same topic was, I think, extremely enriching. And this is what makes this book different from a number of other textbooks in the field that represents, I think, more balanced presentation of a given topic instead of just one angle of one group of scientists which are enamored with their own science. So this is, I think, unbiased approach. And second point, which is definitely worth stressing, that this textbook is really covering from gene to bedside, every possible aspect of disease, whether we speak about diagnosing patients with inherited arrhythmia disorders up to how we could eventually manage them, whether we speak about novel ideas about how to manage patients with defibrillator or atrial fibrillation, again from the basic science all the way to bedside, to optimal treatment, optimal technologies and methodologies for atrial fibrillation ablation, and some other topics. The book for every trainee will be really goldmine for their preparations for not only tests but also for preparation for everyday life, because they will find answers for everything. Of course, science goes forward and we will have definitely new developments coming, but because of internet, because of web links, because of some possible updates, one could easily get further information which will be supplementing to some extent what we have right now in the textbook.